Hi, good morning Aloysius. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 6th of September 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Aloysius Chapel.
Okay. What is your candidate number, please?
My candidate number is 253222532.
All right. Are you taking this test as a nurse?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Why did you choose nursing as a career?
Nursing became my career choice because I've always been deeply passionate about aiding people and having a positive impact on their lives. The dynamic and diverse nature of nursing appealed to me, allowing me to apply my skills and knowledge to deliver high-quality care while supporting both patients and their families. This profession embodies my desire to make a meaningful difference in healthcare.
What skills are important for a nurse to have?
Nurses should possess a range of essential skills, including strong communication abilities, to build rapport with patients, and collaborate effectively with healthcare teams. Critical thinking and problem-solving skills are crucial for assessing situations, making sound clinical decisions, and implementing the most appropriate interventions. Empathy plays a vital role in understanding patients' needs and feelings, ensuring compassionate and respectful care. Additionally, resilience is key for navigating the stress and challenges that often accompany the nursing profession.
How do you handle conflicts with colleagues or patients?
Conflict resolution is a delicate but necessary skill in nursing. When facing conflicts, I follow a structured approach. First, I actively listen to the other party's perspective without interruption, acknowledging their emotions and concerns. Then, I express my own viewpoint, fostering open dialogue. I delve deeper to identify the root causes and common goals, seeking mutually acceptable solutions or compromises. This collaborative process results in a well-considered action plan that all parties agree upon.
How do you prioritize tasks with multiple patients?
Effective task prioritization is crucial when juggling multiple patients or responsibilities. I begin by assessing each task's urgency and importance, based on patients' conditions, preferences, and goals. Categorizing tasks into urgency and importance quadrants helps me focus on addressing critical and time-sensitive issues first. Tasks that are urgent but less important may be delegated or postponed, while those that are important but not immediately urgent are planned ahead to ensure continuity of care. I also make an effort to eliminate or minimize tasks that are neither urgent nor important, streamlining my workflow.
How do you cope with stress or burnout as a nurse?
Stress and burnout are prevalent in nursing, so managing them effectively is essential. I start by recognizing the signs and symptoms, such as fatigue or emotional strain. Identifying the sources of stress, whether it's workload or personal factors, is crucial. Seeking support from colleagues, friends, or professionals when needed is not a sign of weakness, but a smart step. Self-care is another essential aspect. Regular breaks, balanced nutrition, exercise, and relaxation techniques all contribute to resilience. Finally, maintaining a positive outlook by celebrating achievements and practicing gratitude keeps me motivated and helps combat stress and burnout.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-play card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hello, Mihiraa. I see that you have pressed the buzzer. Is everything all right?
No, I'm feeling very uncomfortable. I have a lot of pain in my stomach, and I feel bloated.
I'm sorry to hear that. When did the pain start?
About half an hour ago. It's getting worse.
Don't worry, Mihiraa. We are here to help you. Well, I would like to know the symptoms you have.
Actually, I have stomach pain, and I don't have any other symptoms.
Okay, and have you passed any urine or gas since your surgery?
I haven't.
Okay, let me check your vital signs and your wound dressing.
Okay, you may please.
Don't worry, Mihiraa. This is a common complication after a laparotomy with an ileostomy.
But it is intolerable. Nurse, why can't I go home and get some rest?
Mihiraa, your question is quite natural. Let me explain the reason for your hospitalization. You are being kept in the hospital for several reasons. First, you need to be observed after your surgery to make sure you are stable and recovering well. We will monitor your vital signs, wound healing, and bowel function. Second, you need to manage any complications that may arise from your surgery, such as infection, bleeding, or illness. We will treat you with antibiotics, fluids, or other medications as needed. Third, you need to be discharged after you have a satisfactory recovery.
All right. What's going to happen next?
Mihiraa, your treatment plan is based on your condition and needs. Here are some of the steps we will take to help you recover. We will check your fluid balance charts and blood test results to see if you need any fluids or electrolytes. This is to prevent dehydration, electrolyte imbalance, or kidney damage. We will give you intravenous fluids or oral rehydration solutions as needed. Followingly, we will offer you some ice chips or a sip of water to keep your mouth moist. This is because you are not allowed to eat or drink anything until your bowel function returns.
Okay, I got it.
We will give you pain medication as prescribed by your doctor. This is to relieve your pain and discomfort. Mihiraa, you can ask for more pain medication if you need it, but do not exceed the recommended dose. We will consult with your doctor about your condition and treatment plan. The doctor will come and see you later today and discuss your progress and options with you. The doctor may order more tests or procedures to find out the underlying cause of your pain or infection. The doctor may also suggest another surgery to fix the problem if it is serious. So Mihiraa, please be ready for the next stage of treatment if your condition continues. In the meantime, please try to relax and rest. Do you have any questions or concerns about your treatment plan?
Nurse, will I be able to go home soon?
I'm afraid not. You need to stay here until your condition improves and you are able to eat and drink normally. Mihiraa, if you leave the hospital too soon, you may worsen your condition and develop serious complications. I understand that you may be feeling anxious or worried about your condition, but I want to reassure you that it is not uncommon or untreatable. Many patients experience some degree of inflammation and infection after a laparotomy, especially if they have a history of ulcerative colitis. However, with proper care and medication, most patients recover well and have no long-term complications. You are in good hands here, and we will do everything we can to help you heal.
Nurse, I understand you are following the protocol, but I have been here for too long. Would you kindly see if I can go home?
I understand your concern, Mihiraa. But please don't refuse the treatment without talking to your doctor first. The doctor will explain the benefits and risks of each option and help you make an informed decision. If you deny the treatment, your condition may worsen and lead to more complications. I hope you can see why it is important to follow your doctor's advice and continue the treatment. Mihiraa, your health and well-being are our priority, and we want you to recover fully and safely.
Thank you, nurse, for your consideration.
You're welcome, Mihiraa. Is there anything else I can do for you at the moment?
No, thank you. Just please come back soon.
Of course, I will check on you regularly. Please buzz me if you need anything else. Take care.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.